Today, we change the course of Kentucky's history by taking advantage of new federal laws and billions of dollars in new federal funding. We are expanding eligibility in the Medicaid program to provide health coverage to about 308,000 more Kentuckians. This gives us a huge opportunity. With this decision, Kentucky eliminates a stubborn obstacle to economic success for a substantial number of our working poor. We attack one of Kentucky's biggest weaknesses, dismal health rankings that are among the worst in the nation. We inject about $15.6 billion into our economy over the next 8 years. We create almost 17,000 new jobs. We shield the state budget from costly new federal mandates. In fact, we deflect those financial hits and transform them into an $802.4 million positive budget impact. We protect hospitals from planned cuts in indigent care. We protect businesses from up to $48 million in annual penalties. And for the first time ever, we make affordable health care coverage available to every citizen in the Commonwealth. I want to talk in detail about this decision because the case for it is so overwhelming. This is both the single biggest decision affecting the collective health of Kentuckians in our lifetime, and it was also one of the easiest to make. As you can see from this chart, as of right now, we have some 640,000 Kentuckians who lack health coverage. This expansion makes insurance available through Medicaid to 308,000 of those people. Those whose incomes fall at or below 138% of the federal poverty level. Now, who are these people? Well, some critics of Medicaid expansion like to characterize them as freeloaders waiting for a handout. Well, like many assumptions, that one is inaccurate. Most of these 308,000 people that we're adding to the Medicaid rolls are people with jobs. They're hardworking friends and neighbors doing all they can to pay bills, to put food on the table, and keep a roof overhead. These are people like child care workers, small farmers in the midst of a bad year, truckers, restaurant workers, grocery store clerks, nursing home staff, gas station attendants, and veterans who don't qualify for veterans health care. These people work, but they're stuck. Health care coverage is not provided by their employer. It's too expensive for them to afford on their own, and they don't qualify for Medicaid under current guidelines. This expansion increases the Medicaid eligibility guidelines to 138% of the federal poverty level. As you can see, that's about $15,856 for an individual, $21,404 for a family of two, $32,499 for a family of four. In fact, contrary to what critics think, this decision eliminates the disincentive that keeps some current Medicaid enrollees from working, because under this expansion, impoverished families can work their way up to the middle class without the fear of losing insurance coverage. The other 332,000 uninsured Kentuckians that you see on the chart will be able to access health insurance through the health benefit exchange, the insurance marketplace that I am creating under the Affordable Care Act. This includes some 276,000 Kentuckians who make between 138% and 400% of the poverty level and will qualify for subsidized insurance through the exchange. Now, on the other hand, if we don't expand Medicaid, we will create a coverage gap of about 206,000 people who make less than the federal poverty level and will be ineligible for either Medicaid or subsidized coverage. As you see again on the chart, the federal poverty level is about $11,490 for an individual or $23,550 for a family of 4. We cannot leave these people stranded. It hurts them and it hurts Kentucky. Now, why is it so important that these people have health insurance? Well, studies show that people without insurance are much more likely to skip regular checkups, to go without needed medicine, to delay examinations that catch early symptoms of serious problems, and to seek treatments from specialists. When they do end up seeking treatment, often in an emergency room, their problems are more advanced and thus more difficult and expensive to treat. The lack of early care is one reason that Kentucky's health picture is so horrendous. Look at this chart entitled Kentucky Ranks at the Bottom for Health. We are 50th in smoking. We are 40th in obesity. We're 43rd in sedentary lifestyle. We're 37 in children in poverty. We're 30th in lack of health insurance. We're 50th in preventable hospitalizations, 43rd in low birth rate, 41st in diabetes, 48th in poor mental health days, 49th in poor physical health days, 43rd in cardiovascular disease deaths, 50th in cancer deaths, 44th in premature deaths, 41st in youth obesity, 43rd in youth smoking, 49th in cardiac heart disease. You can go on and on and on. That's the picture of Kentucky's health right now. Our poor health also has a huge impact beyond health care costs. It affects worker productivity. It affects quality of life. It affects school attendance. It even affects our state's image. Study after study on the state and national levels show a correlation, a very strong correlation between health coverage and health status. Expanding Medicaid will create a stronger Kentucky. Now, some people, without any real evidence, say Kentucky can't afford to take this step. Well, folks, the facts say otherwise, overwhelmingly. Not only can we afford it, but we come out ahead in both the short term and especially over the long haul. In fact, if we don't take this step, our hospitals, our businesses, and our state budget all take a financial hit. How do I know this? Because we sought outside expertise. We hired not one, but 2 independent experts. The Urban Studies Institute at the University of Louisville to do an economic impact study, and the PricewaterhouseCoopers actuarial firm to do an analysis of cost and benefits. Their findings provide an absolutely overwhelming case for taking this step. Let's look at the numbers. The federal government will pay 100% of the cost of care for these 308,000 Kentuckians for the first 3 years, beginning January 1 of 2014, and an average over the next 8 years of over 95%. When the program's fully implemented in 2021, the split will be 90-10. Compare that to our current customary split of 70-30. This extra care creates very positive financial outcomes for our economy and our budget. It leads to the creation of about 17,000 new jobs, both in healthcare providers and in sectors that support those providers and their employees. It creates a positive economic impact of approximately $15.6 billion in Kentucky because of those extra goods and services and the spending that flows from them. And it creates over 8 years a positive impact on the state budget of $802.4 million. Look at this chart entitled Cumulative Net Budget Impact of Affordable Care Act and Medical Expansion, because it's a very important number, one that absolutely refutes the Kentucky can't afford this argument. The top line, the green line, shows the cumulative impact on our state budget of Medicaid expansion over 8 years, $802.4 million. Now, a lot of things go into that number. It includes the taxes generated by 17,000 new jobs. It also reflects some shifting of Medicaid expenditures. As you know, Medicaid is jointly funded by the state and federal government. Under Medicaid expansion, the state is allowed to shift certain expenditures from the state to the federal government. Now, just so you know, that positive budget impact of $802.4 million does take into account the state match that will be required after year 3 of the program, the match that some allege we just can't afford. It also includes the impact of changes spelled out in the Affordable Care Act that allow additional costs to states and reduce funding for specific programs. These include things like additional substance abuse treatment, reduction in subsidies for indigent care, additional administrative cost, and people already eligible but not enrolled in Medicaid who will come out of the woodwork as the Affordable Care Act takes effect. That's what you see on this bottom line, the red line. This is if we do not expand. As that bottom line demonstrates, those additional costs and the revenue cuts on Kentucky, regardless of whether we expand Medicaid. And you see that if we don't expand Medicaid, the cumulative impact on our budget is negative. We will be nearly $40 million in the hole at the end of the 8-year period. Obviously, there's a big difference between a positive $802 million and a negative $40 million. It's obvious that Medicaid expansion in Kentucky more than pays for itself. The question really shouldn't be, can we afford to expand Medicaid? The question should be, can we afford not to? This chart, by the way, doesn't take into account 2 things I mentioned earlier: the potential impact on our businesses and our hospitals. If we don't expand Medicaid, Kentucky employers could face fines of between $32 and $48 million a year for failing to provide affordable insurance for their employees. Furthermore, the Affordable Care Act cuts the funding we use to reimburse hospitals for providing indigent care in Kentucky. It'll cut it by $287.5 million because it assumed those people would be moved to the Medicaid rolls. So if we don't expand Medicaid, hospitals will have to make up that difference on their own. It's no surprise that numerous healthcare advocacy groups, as well as medical providers and local officials, support expanding Medicaid. In fact, we have a list of about 100 organizations which have expressed that support. Groups like AARP Kentucky, Children Inc., the Kentucky Council of Churches, Louisville Metro Board of Health, and Eastern Kentucky University, just to name a few. Now, as for the naysayers, they express vague and broad anxieties about cost, fears which the facts refute, and they fall back on partisan national politics. If Kentucky expands Medicaid, they ask, won't Kentucky be supporting Obamacare? Well, to them I say, get over it. Get over it. know, the Affordable Care Act was approved by Congress, sanctioned by the Supreme Court, and is the law of the land. Kentucky's the 21st state to expand Medicaid under the Act, and many others are considering it. Governors across the nation, both Democrats and Republicans, in big states and small, have signed on. If you want to embrace Washington-style politics and invoke Washington-style arguments and embroil Kentucky in a Washington-based debate, then go to Washington, because we don't need you in Kentucky. This is Kentucky. I'm Kentucky's governor, and I'm going to do what's best for Kentucky's people, period. You want to fix this? Thank you. That's much better, isn't it? Folks, this is not a political debate. This is a policy decision. This move makes sense not only for our health, but also for our pocketbook. More importantly, it makes sense for our future. I've spent 5 years as governor, like many governors before me, focusing on 3 fundamental needs of our state: education, health care, and job creation. Those 3 areas, more than any others, will dictate whether Kentucky succeeds. And those 3 areas, more than any other, are intertwined. With a healthier, smarter, and more energetic workforce, we greatly strengthen Kentucky's ability to attract jobs and improve our quality of life. By using mostly federal funds to provide health insurance for 308,000 more working Kentuckians, we can, with this move, take a tremendous step forward in that mission. And the bottom line is simply this: it's the right thing to do.